All right, so today we're taking a deep dive into addiction. We've got a ton of research here. Everything from like neurochemistry to the social factors, even the legal stuff about different drugs.
Yeah, it's going to be a fascinating journey. We're really going to unpack how addiction actually works,
Yeah.
going way beyond just that simple idea of just getting hooked.
Okay, so let's unpack this. First things first, we need to define what we're even talking about. What is addiction beyond, just liking something a lot?
Okay, so think of it this way. It's like the difference between really enjoying a piece of chocolate cake and feeling like you absolutely have to eat the entire thing, like consequences be damned. And that's where organizations like the World Health Organization come in. They define addiction as like compulsion and craving, not just enjoyment. It's that inability to stop, even when you know it's causing like serious problems in your life.
So it's that feeling of being trapped in a cycle, wanting and needing the substance, even if it's not giving you that same high anymore. That brings us to tolerance, right? It's
Yeah,
like your brain is kind of getting used to the substance.
exactly. Imagine your brain's like a volume knob. When you repeatedly use a substance, it's like your brain turns the volume down on those pleasure signals. So you need more and more of the drug just to hear that same effect. It's a physical change in your reward system. And it's like a key part of tolerance.
So if someone's taking like pain medication for a chronic condition and they
Yeah.
build up a tolerance, does that automatically mean they're addicted?
Not necessarily. Tolerance is just one piece of the puzzle. It's that physical adaptation. Addiction is more about the compulsive behavior, the inability to stop despite those negative consequences.
But I'm thinking about tolerance and withdrawal together. It seems like they kind of form this push-pull dynamic that traps you in the addiction cycle. You
Mhm.
have the tolerance building, making you need more, and then you have that awful withdrawal when you're not using, pushing you right back to the substance.
You've hit the nail on the head. Withdrawal is a major driver in that cycle of addiction. It's that intense discomfort, like both physical and emotional, that pushes you back towards the substance even if you know it's harmful. At that point, your brain isn't even seeking pleasure anymore. It's seeking relief from how bad it feels without the substance.
This is where it really starts to feel less like a choice and more like a disease, doesn't it? Like something's hijacking your brain.
Absolutely. To understand that, we need to look at what's happening in the brain when addiction takes hold. There are a few key areas involved. First, we have the basal ganglia, which is like the brain's pleasure center. Then there's the extended amygdala, which is all about our stress response. And finally, the prefrontal cortex, which is responsible for decision-making and self-control.
So it's like different parts of your brain are battling each other. The pleasure center wants the drug, while your decision-making center is struggling to resist. Is that right?
That's a great way to put it. And the substance is really throwing a wrench in the works. Let's take dopamine, for example. It's the feel-good neurotransmitter, and substance use causes a huge surge of it in the basal ganglia, creating that intense pleasure. But with repeated use, your brain adapts. It's like it gets used to all that extra dopamine and starts to tune it out. So you need more and more just to feel normal, let alone get high.
So you're essentially stuck chasing a ghost, a high you can never truly reach again. This explains why addiction is so powerful and hard to break. But I have to ask, before we even get to that point, why do people even start using substances in the first place? It can't all be about chasing that high, right?
You're right. There are multiple pathways to substance use. Some people are seeking that rush of pleasure, that feeling good, but others are trying to feel better. They might be dealing with emotional pain, past trauma, or even mental health conditions.
So they're self-medicating, in a way.
Precisely. And then you have people who are seeking to enhance their performance, whether it's in academics, athletics, or their careers. They're looking for that boost in focus, energy, or endurance. And let's not forget the role of curiosity and peer pressure, especially for young people. It can be tough to resist when everyone around you is doing something aren't.
It's amazing how these different motives can lead to the same outcome, no matter the reason you start. The brain can get caught in that cycle of addiction. But this brings up a question. If there are so many starting points, what are some common risk factors that might make someone more susceptible? Is it all just about willpower, or is there more to it?
It's definitely not just about willpower. There's a whole interplay of factors that contribute to addiction. Researchers often talk about the epidemiologic triad to help understand this.
Okay, I'm intrigued. What's this triad all about?
So imagine a triangle with 3 points. One point is the agent. That's the substance itself, how potent it is, how quickly it affects the brain, how easy it is to get. Another point is the host. That's the individual, their genetic makeup, personality traits, mental health. any personal vulnerabilities. And the final point of the triangle is the environment. And that's everything from family dynamics and social circles to bigger societal issues like poverty or even cultural attitudes towards substance use.
So you're saying it's a combination of the drug, the person, and their environment that really determines the risk.
Exactly. And what's fascinating is how these factors interact. Someone might have a genetic predisposition that makes them more sensitive to a particular drug. But if they have a strong support system, like a
Hmm.
loving family, close friends, that can actually act as a buffer and reduce their risk.
That makes sense. It's not just nature versus nurture, it's both working together. And of course, everyone's experience is going to be different based on their unique combination of risk factors. But some people might argue that it ultimately comes down to personal responsibility and choice. How do you respond to that?
It's a complex issue for sure. While personal choices definitely play a role, we can't ignore the powerful biological and environmental forces at play. Think about it this way. If someone breaks their leg, we don't blame them for their weak bones. We treat the injury and help them heal. Addiction is similar. It's a disease that affects the brain, and it requires a compassionate and scientific approach to treatment and prevention.
That's a really good analogy. Okay, so we've talked about why people start using substances and what makes some people more susceptible to addiction. But let's dive back into the brain science for a minute. We touched on dopamine and the reward system. But what's actually happening at a cellular level? Is it like the brain is getting rewired?
You could say that. Remember those dopamine receptors we talked about? They're like tiny doorways on brain cells. And dopamine is the key that unlocks those doors, triggering feelings of pleasure and motivation. With repeated substance use, those doorways become less responsive. The locks get rusty, so to speak.
So the brain is trying to protect itself from this constant flood of dopamine, but it ends up backfiring.
Precisely. It's a process called neuroadaptation. The brain is trying to maintain balance, but it ends up making those initial pleasurable effects harder and harder to achieve. This is why people with addiction need more and more of this substance just to feel normal, let alone get high.
And we can't forget about the impact on other brain areas, like the prefrontal cortex, the part of the brain that helps us make good decisions and resist impulses.
Absolutely. Substance use can really impair the prefrontal cortex, making it harder to resist cravings, think about consequences, and make rational choices. It's like having faulty brakes. It's much harder to stop the car from going over the edge.
So you have this combination of increased cravings, less pleasure from normal activities, and difficulty making good decisions. No wonder addiction is so hard to overcome. But we also have to acknowledge that not all substances are created equal in terms of their risk and potential for harm, right? That's where the drug scheduling system comes in.
Exactly. The drug scheduling system is like a risk assessment tool. It helps us understand the potential for harm and the level of control needed for each substance. For example, Schedule E drugs, like heroin, are considered the riskiest, with high potential for abuse and no recognized medical use. Then you have Schedule II drugs like cocaine and methamphetamine, which are also highly addictive, but may have some limited medical applications.
And on the other end of the spectrum, you have things like cough syrup with codeine, which is Schedule V,
Yeah.
and have a much lower risk profile.
Right, and in between you have Schedules 3 and the 4, which include things like some prescription painkillers and anxiety medications. Each schedule reflects the level of control and regulation surrounding a particular substance.
So it's like a hierarchy of risk. And this helps determine things like prescribing practices, penalties for possession, and research regulations. It seems like a good system for trying to manage the potential harms of different substances. But I'm curious, what's the percentage of people who try a substance and actually become addicted? Because it feels like we often hear these scary statistics, but I wonder how much of that is fear-mongering versus reality.
Well, it really varies depending on the substance. Our research has a table showing the probability of dependence for different drugs.
Okay, what does it say?
For example, tobacco has the highest probability of dependence.
Yeah.
If you've tried tobacco at least once, there's about a 32% chance you'll become addicted.
Wow, I didn't realize it was that high. What about heroin, since it's often seen as the most addictive drug out there?
Heroin comes in at about 23%, lower than tobacco, which might surprise some people. Cocaine is around 17%, and alcohol is at 15%.
Interesting. So even with a substance like heroin, which has a reputation for being highly addictive, the majority of people who try it don't actually become addicted. It really highlights how addiction is about more than just the substance itself. It's that combination of factors we talked about, the drug, the person, and the environment.
Exactly. It's that complex interplay that ultimately determines someone's risk.
Okay, so the numbers give us a clearer picture, but it's still a pretty sobering reality. Now, I want to shift gears a bit and talk about prevention. What can we do to prevent people from falling into the trap of addiction in the first place?
That's where understanding those risk factors is so important. Early intervention programs can really make a difference, especially for young people. We can teach kids healthy coping mechanisms for stress and difficult emotions, so they're less likely to turn to substances in the first place. We can also address mental health issues early on, since they often co-occur with addiction.
It's about giving people the tools and resources to make healthier choices, especially during those critical periods of development like adolescence.
Absolutely. And education is key. We need to teach people about the dangers of substance use, the signs and symptoms of addiction, and where to seek help if they need it.
It's about changing the conversation around addiction. We need to see it as a health issue, not a moral failing, and create a culture where people feel comfortable seeking help, without shame or fear. But what about treatment? Once someone is struggling with addiction, what are the most effective approaches for helping them recover?
The good news is there are several evidence-based approaches out there. For some people, medication can be incredibly helpful. It can manage those really difficult withdrawal symptoms and help reduce those cravings, especially for opioid or alcohol addiction.
I've also heard a lot about different types of therapy being effective, like cognitive behavioral therapy or motivational interviewing.
Uh, Absolutely. Behavioral therapies are really important for tackling the psychological side of addiction. They can help people identify their triggers, develop coping mechanisms, and build those healthier habits.
So it's like retraining your brain, learning new ways to think and respond to those cravings and urges.
Exactly. It's about rewiring those pathways that have been hijacked by addiction.
And what about support groups like Alcoholics Anonymous or Narcotics Anonymous? I imagine those can play a big role in recovery too.
They can be incredibly powerful. They provide a sense of community,
Yeah.
accountability, and shared experience. Having that network of people who understand what you're going through can make a world of difference.
Like you're not alone in this fight. You have people to lean on who've walked a similar path. It seems like the most successful approach to treating addiction is like a holistic one, addressing the physical.
Psychological and social aspects. But let's be real for a moment. Relapse is a big part of this conversation. It can feel so discouraging for people trying to recover.
It's true. Relapse is a reality for many people. But it's important to remember that it doesn't mean treatment has failed. Think of it like any other chronic illness. There can be setbacks, but that doesn't erase all the progress that's been made. So it's like a bump in the road, not the end of the journey. What can we do to reduce the risk of relapse and support people through those challenging moments?
Continuing care is crucial. This might include ongoing therapy, support groups, or a sober living environment. It could also involve regular check-ins with a healthcare professional.
So it's about having that safety net, that system of support to help people navigate the ups and downs of recovery. Something we haven't talked about much is the stigma surrounding addiction. It still feels like a major barrier for people seeking help.
Stigma is incredibly harmful. It prevents people from getting the help they need and perpetuates the idea that addiction is a moral failing rather than a health condition.
It's like blaming someone for having a broken leg.
Exactly. We need to challenge those harmful attitudes and create a more understanding and supportive environment.
That means using respectful language, avoiding judgmental terms, and recognizing that addiction can affect anyone, regardless of background or circumstances.
It's about seeing the person behind the addiction, treating them with dignity and respect, and remembering that recovery is always possible.
This has been a pretty intense deep dive into addiction. We've covered everything from the brain science to the social factors, treatment options, and the stigma surrounding it all.
Yeah, it's a complex issue, but understanding the science, the risk factors, and the pathways to recovery is essential for creating a more informed and compassionate approach to addiction.
Absolutely. And for everyone listening out there, what resonated with you the most today? What surprised you? What questions are still swirling around in your mind? This deep dive was just a starting point.
We've only scratched the surface, but hopefully it sparked your curiosity to learn more.
We focused a lot on substance addiction, but what about behavioral addictions like gambling or excessive internet use? Those are becoming increasingly common. And many of the same brain mechanisms are at play.
It's definitely an area worth exploring. It raises some fascinating questions about how our brains respond to rewards and how those reward pathways can be hijacked by certain behaviors, even in the absence of a substance.
Yeah, it makes you think about how we interact with technology and the potential risks involved. It's about setting healthy boundaries and being mindful of our habits.
And of course,
Yeah.
just like with substance addiction, Early intervention and support are key.
Well, folks, that wraps up our deep dive into the world of addiction. It's been a journey, but hopefully you've come away with a deeper understanding of this complex and often misunderstood condition.
Remember, knowledge is power. Use what you've learned today to challenge your own assumptions, to have more informed conversations, and to advocate for a more compassionate approach to addiction.
And keep asking questions, keep exploring, and keep learning. Addiction is a topic that touches all of us in some way, directly or indirectly. The more we understand it, the better equipped we'll be to create a healthier and more supportive world. Until next time, stay curious, stay informed, and stay compassionate.